loneliness is paradoxical. Humans can be surrounded by other humans that they know care for them deeply and feel completely alone. And humans can be on the other side of the globe from their support system and viscerally feel loved and connected to them, right? So what does that say? There's something that some people are doing that generates that feeling of social connection, and we hypothesize that our folks who are chronically emotionally lonely, even if they have long-term relationships, are not doing those same things. So RO DBT is the treatment modality that tries to provide people with skills to get that visceral feeling of connection to the members of their tribe.
So you might be asking, what are some things to be on the lookout for in my sessions with clients? And so according to the RO DBT framework, right, we have two subtypes of overcontrolled coping. We have overly agreeable clients, right? And we have overly disagreeable clients, right? And so our overly agreeable clients are the ones that present as usually very polite, maybe even quieter, not exhibit actual distress that they're experiencing on the inside. Whereas the overly disagreeable subtype is what we refer to lovingly as our edgelords. You know, they're kind of like, I'm too cool for school a little bit. They're more likely to voice cynical thoughts, you know, sometimes even antisocial thoughts about the world, about others. And so those are kind of the two presentations that you can see when it comes to overcontrolled coping. What we found in the research is that most clients coming into outpatient therapy are towards that end of the spectrum of overcontrolled coping. And so we can stand to learn a lot of skills as clinicians to help those clients who take up a lot of our caseload.
So you might be asking yourself, how do I know if somebody's a good fit on my caseload for RO DBT? And if they are a good fit, what do I need to do to get them into skills class or the program?
Yeah, so what we usually start off with is having clinicians give their clients the overcontrolled self-assessments. There are 3. There is the personal need for structure scale, there is the word pair, and then the OC trait rating scale.
It's ideal if those self-assessments are done prior to submitting an inter-office referral form, but it's not necessary because we can collect that data after. But really what we're looking for is a visceral emotional reaction from the client to the self-assessments, because that is the strong indicator of overcontrolled coping or personality. So from there, once the inter-office referral is done, I reach out to the client directly over email. I will typically say to the clinician, hey, could you reinforce for the client to keep an eye out for my email? And we get them set up with an orientation session with one of the RO DBT clinicians. And our orientation process is totally virtual, so it will be a tele-appointment for them. And it can be done in as few as 3 appointments and as many as 4, just depends on the client's response to the orientation material. The orientations would be individual therapy sessions, so the same CPT code, but the RO DBT clinician will manage all of the documentation and billing for those. And essentially at the end of session 3 or 4, depending on how fast it goes, the client and the assessing RO DBT clinician will have a conversation about whether or not the client wants to join the program and start skills class. And if they do start skills class, whether they would like to try and be paired with an RO clinician for the high fidelity program or continue with their therapist that they already have and do a less high fidelity version. And in RO DBT, we're very flexible on this. We say it depends. So what we're trying to do is make it a mutual decision between all 3 people. That is the referring clinician, the RO DBT assessing clinician, and the client.
In order for your client to join the skills group, that doesn't necessitate that they work with an RO DBT clinician, right? Sometimes we might not have the amount of clinicians that would be able to meet that need. And so you are more than welcome to continue working with your client. So part of that might look like joining consultation meetings every Friday in Cassie's room, just to consult about your client who's in RO DBT. I think that's the easiest way to learn the content. You can also observe our skills class every Tuesday from 5:15 to 6:45 to learn more about what your clients are doing in their group.
So RO DBT is a relatively newer treatment modality. It's about 20 years old, and it pulls from a lot of different sources of wisdom, traditional CBT and psychology, some philosophy. There might be elements of RO DBT that you are already using and you don't even know, right? But by learning more about the modality, you can become more self-conscious, more intentional as a clinician about identifying your clients' barriers to their life worth sharing, right? If that sounds interesting to you, I would strongly encourage that you get on the Academy website and enroll in the RO DBT crash course. Devyn and I in 2025 are going to start working on a more skills-based, practical, what do I do as a clinician CEU that's going to be available on the Academy. Of course, if you really want to invest, the way to get formally trained is to go to Radically Open. That is the organization that owns the RO DBT treatment modality. Dr. Thomas Lynch, go to Radically Open and you can register for the trainings there. But mindfully, internal trainings are a great, more budget-friendly way to get started. Come check out Consult Team anytime. We're always happy to have you. If you would like to observe a skills class, that is an option. I just ask that you reach out to me via email in advance so that we can kind of control the flow. I think it's a really good treatment modality for clinicians to invest in because it's so new and it's not available in many places. So if you want to be on the ground floor, right, getting established in this area, now is the time to get involved.